So that's the vector-borne diseases, but the problem that we are specifically trying to address is that this problem in many places in the world, both in Europe and in Africa, is actually a growing problem. They are not in a steady state. They are very much affected by climate change, changes in temperature, changes in precipitational patterns. So that means that we are seeing an increase in outbreaks of various diseases, including, for instance, Rift Valley fever, dengue, West Nile virus, chikungunya, fasciolosis, and schistosomiasis. And this is a global phenomenon because these diseases do not know borders. So that means we are affected in Europe and you are affected to a high degree in Africa. So it is a problem that we are sharing. And due to this, the impact of climate change, this is very often something that also catches headlights in the media, because new diseases sometimes arrive in areas that are not, where the diseases are not familiar to people. They can be a challenge to tackle for the health communities, and they can be a challenge to tackle just in general, because organisms move in that we were not aware of could actually appear. And in essence, this is what we would like to try and address from a very, very broad perspective in this project.
So we did investigate the burden of this disease in human populations as well as animals, because the epidemiology of this disease is tagged to animals. Basically, we are collecting samples from farms in those locations, as well as animals that are brought to slaughter in the abattoirs, as well as testing people who work in these abattoirs. Overall, we examined over 2,000 samples from animals and over 300 specimens from humans, and we did found out that out of the 365 individuals that we tested, we were able to identify 2 cases of human infections for the very first time since this study has been done in Uganda.
We have a One Health platform where the directors of animal health, human health, wildlife, water environment sit together and look at the issues affecting their sectors that can be shared across the board, and implementation issues taken down through our departments for implementation. So that framework exists in Uganda, and I'm sure that areas that require that kind of approach are also going to be looked at. What has been lacking as a gap is the ability to share data